For someone with multiple systems atrophy, the Parkinsonian type, this is when there's going to be widespread damage to the brain, but that damage is going to overlap with the part of the brain that also causes Parkinson's. And so that person with MSA will also have Parkinson's-like symptoms. Primarily with MSA, the cerebellum, the basal ganglia, and the brainstem are all affected. They all basically shrink over time. They atrophy, they shrink. And so for someone with Parkinsonian type, it's the basal ganglia that really overlaps with Parkinson's. The basal ganglia produces something called dopamine, which helps with movement. And so that's why we see these movement disorders in someone with Parkinson's or MSA-P, Parkinsonian type. So with MSA-P, we can see slowed movements, we can see muscle rigidity, poor balance, that slurred, soft speech called dysarthria, where they really can't get the words out and it's really hard to understand them and it's really soft speech. We can also see tremors. Medications like levodopa or those dopaminergic medications to help with dopamine don't usually work very well or for very long in someone with MSA, Parkinsonian type. And because with MSA, there is more of this widespread damage throughout the brain, we also see a lot of other problems. Specifically, I think about the autonomic or think automatic nervous system. So think that we breathe automatically, that our heart beats automatically, that our digestive tract works automatically. So this person might experience something called postural hypotension, where their blood pressure drops as soon as they change positions. They oftentimes have a bunch of different sleep problems. They have problems with sexual functioning. They have heart or cardiovascular problems. So you might notice that they have cold hands and feet, or the colors of their fingernails or their toenails might change color to like a bluish type of color because of poor circulation. And it's also not uncommon for people to have sort of these psychological or psychiatric type behaviors. So they have a really hard time controlling their emotions. And they also have problems with sort of controlling their body temperature. So they have a hard time sweating. So they're very heat sensitive. So all of these sort of automatic functionings of our body, the brain just can't work those things anymore. Most people with MSA-P will need full assistance with really all care, usually within about 5 years or so. They really can't walk around or do anything on their own. They have trouble swallowing. They have ongoing breathing problems. They have more and more problems trying to communicate or talk. And at this point, a hospice consultation would be a next step for supportive care. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education.